Cholesterol, the 50-year medical misconception that's harming millions. An evidence-based perspective from functional medicine. When a number becomes a diagnosis. Every year, millions of people leave their doctor's office clutching a lab report and a prescription they didn't ask for. LDL is above the threshold. Statin is dispensed. No further questions. No broader context considered. What makes this particularly troubling is that many of these patients are genuinely improving. They're losing weight, gaining energy, watching their metabolic markers trend well. Yet a single unfavorable LDL number is enough for their physician to recommend abandoning a healthy lifestyle and reverting to a low-fat diet. This is a systemic problem, and it stems from one fundamentally flawed assumption: confusing correlation with causation. Cholesterol is consistently found at sites of vascular damage, but concluding that cholesterol causes heart disease is like blaming the fire department for arson. Cholesterol is the body's first responder. It arrives at sites of injury to repair, not to destroy. When we wage war on cholesterol, we are fighting our own ally while the real enemy operates unchecked. The three actual drivers of atherosclerosis: chronic low-grade inflammation, insulin resistance, and oxidative stress. Cholesterol alone does not carry a strong correlation. Not high or low, but balanced or unbalanced. A person with a total cholesterol of 350 may be in excellent cardiovascular health. A person at 190 may be in genuine danger. The absolute number means very little without context. A total cholesterol below 150, in fact, warrants more concern than one sitting at 280. Cholesterol is an essential molecule the body manufactures deliberately, the markers that actually matter. First, total cholesterol to HDL ratio, a far more meaningful predictor of cardiac risk than LDL in isolation. Second, triglycerides and HDL. Elevated triglycerides paired with low HDL is the metabolic signature of insulin resistance. Third, VLDL, an excellent window into insulin resistant status. Fourth, LDL particle size, the metric almost nobody tests. Bad LDL is actually damaged LDL. LDL is not inherently harmful. Under healthy conditions, it is an indispensable transport vehicle. The problem begins when oxidative stress, chronic inflammation, and sugar damage and shrink these particles. Small oxidized LDL is no longer recognized. It penetrates the arterial inner lining. Macrophages engulf these particles, forming foam cells, which accumulate into atherosclerotic plaque. What statins actually do, and don't do. Statins work by upregulating LDL receptor sites in the liver, prompting greater reabsorption of healthy particles. Furthermore, statins inhibit HMG-CoA reductase, critical for producing not only cholesterol, but also CoQ10, involved in 95% of cellular energy production. Suppressing it leads to fatigue, muscle weakness, and cognitive fog. A drug prescribed to protect the heart reduces the energy the heart depends on. The cholesterol-brain connection is also vital. The brain contains 25% of the body's total cholesterol, essential for synaptic function. Higher cholesterol in later life is often associated with better cognitive outcomes. Statins can cause memory lapses, leading to FDA cognitive impairment warnings. So what should you ask your doctor? Move beyond blunt Tier 1 markers. Request Tier 2 markers like fasting insulin, HSCRP, and VLDL. Seek Tier 3 assessments like NMR-LDL particle count and a CAC score. These markers show your fundamental cardiovascular position. The dietary architecture is clear. Eliminate refined sugars and processed carbohydrates. Rehabilitate healthy fats like olive oil, avocado, and omega-3s. Lifestyle levers like sleep quality, physical movement, and stress management are central, not peripheral. Final thought: treat the environment, not the molecule. Address the fire, inflammation, and insulin resistance, and cholesterol returns to its protective role. This video is for educational purposes only. Consult a qualified healthcare professional before making clinical decisions. Cholesterol, the 50-year medical misconception that's harming millions. An evidence-based perspective from functional medicine. Every year, millions leave their doctor's office clutching a lab report and a prescription they didn't ask for. LDL is above the threshold, statin dispensed, no further questions, no broader context considered. Many of these patients are genuinely improving, losing weight, and gaining energy. Yet a single unfavorable LDL number is enough to recommend abandoning a healthy lifestyle for a low-fat diet that is already proven largely ineffective. Cholesterol is found at sites of vascular damage, but concluding it causes heart disease is like blaming the fire department for arson. Cholesterol is the body's first responder. It arrives at sites of injury to repair, not to destroy. We are fighting our own ally. The three actual drivers of atherosclerosis are chronic low-grade inflammation, insulin resistance, and oxidative stress. These are the real enemies. A person with a total cholesterol of 350 may be in excellent health, while one at 190 may be in genuine danger. Context is everything. Total cholesterol to HDL ratio is a far more meaningful predictor. An optimal target is below 3.5. This matters more than LDL in isolation. Elevated triglycerides paired with low HDL is the metabolic signature of insulin resistance, the combination that genuinely signals cardiovascular danger. LDL is not inherently harmful. Under healthy conditions, it is an indispensable transport vehicle delivering fats to tissues throughout the body. The problem begins when oxidative stress and sugar damage these particles. Small, oxidized LDL is no longer recognized by liver receptors. These damaged particles accumulate and penetrate the arterial lining, forming foam cells and atherosclerotic plaque. The real culprits? Sugar and stress. Statins reduce the LDL number, but they predominantly clear the harmless particles. The dangerous, small, oxidized fraction often remains untouched. Statins also inhibit CoQ10 production, essential for 95% of cellular energy. This leads to fatigue, muscle weakness, and even cognitive fog. Consider a patient who adopted a low-carb diet. Their LDL number stayed the same, but their small LDL particles fell by 26%. Eliminate refined sugars. Restore insulin sensitivity through movement. Monitor the markers that actually matter like VLDL and particle size. Cholesterol is the structural foundation of life. Treat the fire, not the firefighter. Consult with a professional for clinical decisions.